Thank you, Frank. My name is Boris Azaïs. I work for MSD as a Director of Industrial Policy. And after a full day of conference, I guess you get the sense of what we're trying to do here, which is to challenge our knowledge and challenge our understanding about the healthcare systems. And you may wonder why today I'm presenting from working for a pharmaceutical company, and I'm presenting on innovative delivery systems, innovative ways to deliver healthcare. It's primarily because I participated in the drafting and elaboration of a report that looked at new models of delivering healthcare. And the reason why we're involved in this type of report, and as much as we involved through various work that has been referred to by our colleague from McKinsey through the World Economic Forum, it's because we care about healthcare. And we actually care about the sustainability of our healthcare systems, and we are concerned that the sustainability of our healthcare systems is heavily linked with its ability to embrace change and embrace innovation. And this is the reason why a company like MSD is involved in healthcare policy discussions, but this is true of other companies. I want to make that clear, is that there's a lot of companies, research-based pharmaceutical companies, that participate actively in healthcare policy for that reason, because we are a key part of the healthcare system, and we would not exist without a strong and sustainable healthcare system. So, the good thing about coming last during the day is that we've seen already a lot of the evidence about the challenges that are faced to healthcare systems. And just a way to summarize, we have to keep in mind what it is for healthcare policymakers, what is their mission in life and how they try to achieve their public health objectives. And they're faced with this healthcare iron triangle. Basically, they have to deliver improved access to quality healthcare without breaking the budget. And if you think about the mission and the vision of the Croatian healthcare system that we've seen earlier at the previous session, but even this morning also it was mentioned, it basically contains these elements of providing better care, but also taking care of efficiency. So I don't need to go through the same challenges. You get it. There's a number of challenges that we face for healthcare systems, and we will have one way or the other to find solutions, because there is no way back in healthcare in history. So that would be quite dramatic for our generation to be the first one to go back in healthcare standards in human history. One thing I wanted to point out in these challenges, it's really the demographic shock, but not just because we are going to see an increased number of older people. And again, here, you heard it from Rainer Münz this morning. This is a great thing, of course, because when you're faced with older age, you have also to think about the alternative. But the problem is really for healthcare professionals. How are we going to maintain our healthcare systems with a decreasing amount of healthcare professionals? Within the next 10 years, across the OECD, you have 1/3 of healthcare professionals who are going to retire. That's as strong as demographics. It's basically a fact today. It's going to happen. So we need to eventually find new ways, better ways, innovative ways to deliver healthcare. And the purpose of my talk here is really to share state-of-the-art thinking or practices, innovative examples of how to deliver better healthcare at a lower cost in various settings. So one thing that policymakers in healthcare face, especially now that they have to go back more and more to finance ministers, is that our healthcare systems, the way they're designed, are highly inefficient. This is just results from a survey done by IBM, Kaizen in car manufacturing, or Six Sigma, or lean manufacturing, and so forth. There's been a lot of innovation in system organization that for some reason hasn't reached the healthcare system. Think about, you know, the car industry and what it meant 30 years ago to start a car. You weren't sure that the car would start, actually. You know, you had to, each morning, you had to manage somehow, and maybe, you know, 3 times, wait a bit, 4 times, wait 5 minutes, and so forth. Of course, today you expect your car, you don't even think about it. You don't even think, well, you know, maybe the car won't start. So, this has happened not just by technological progress. It has happened because there are new ways that have been developed in the car industry to, you know, put the whole manufacturing process around the car. So for some reason, I hear some similarities, and it's a bit provocative when I hear about, you know, patient centricity. Say, well, are we really there? Is there, you know, is there an integrated dialogue among all the people who have to deal with what is a patient, so that they communicate when there's a problem, they integrate their own services and so forth. And these are the problems that are affecting our healthcare systems today, and these are the problems that some of those solutions are trying to solve. One of the starting point of this report on innovative healthcare delivery models was to really focus on human capital. And here, again, when we think about inefficiencies or lack of productivity, we think about the working, the paid workforce, the healthcare professionals. While in fact, we know by experience that healthcare is very much happening outside this formal system. There is a lot of organizations and people involved in the informal part of the care. In fact, if you have to deal with chronic disease, you're basically on your own. You know, most of the care that you receive when you're having a chronic disease is self-care. You have to deal with your disease yourself, and eventually you're developing a really high level of expertise of what works for you, what doesn't work, you know, your compliance and you know, your lifestyle and so forth. And this is why we see, you know, a lot of, you know, patient movements who are basically saying, look, I know probably as much, if not better, what works for me than the formal healthcare provision system. So we need to really embrace these needs and opportunities to increase what we call the human capital across this whole spectrum. Sorry. So this report was basically came from work that was done through the World Economic Forum and various academic institutions like Duke University in the US. And the starting point was to identify really innovative ways of delivering healthcare across the world. So not only in developed countries, but also in developing countries, and try to see what has worked, why is it just at the local level? Can it be deployed at the regional level? Is there something to learn? And in the report that I'm basically reporting about here today, we teased out 9 case studies, and 9 case studies that could perfectly illustrate some of the lessons that can be learned from these innovative models. And here, you know, I don't have enough time to go through those examples, but I invite you to look at the report, which is a really good read. But just taking, you know, 4 examples so you get an idea of what we're talking about. Things has, you know, radical or science fiction sounding, such as an automated machine to deliver prescription products on 24 hours, 7 days a week. There is a very good reason why this has been developed, and it's been deployed in 34 states in the US, because you have large rural areas, empty spaces, where eventually it's pretty hard to get access to your local pharmacy. So why not just put an automating machine based on e-prescription, which is going to deliver your prescribed medicine when you need it, and when you're able to go get it. And if you have a question, there's a video link to a pharmacist. So these technologies are out there, Skype, email, so forth. there's a good reason in healthcare that we could embrace some of those technologies. It's not a cost issue here. Something in the UK, the Marie Curie Cancer Care, they developed this initiative called Delivering Choice. And Delivering Choice is basically looking at end-of-life care. And they realized that the patients in end-of-life care would receive visits from healthcare professionals for different reasons, several times a day, several times a week. And that was extremely disruptive for those patients. And so they decided to centralize, to create a new job, a care and social coordinator who doesn't need to be a doctor, who doesn't need to receive a long training. Actually, it's based on a 3-week training and monitoring. And this person is going to be the key interlocutor for the patient and the healthcare service. And again, as a patient, or as the parent of a patient, you can realize the need for this type of new system or new delivery method, because otherwise you have to run a micro enterprise when you're dealing with an old patient with multiple morbidities. Basically, you have to face the healthcare system on your own. So there's really great opportunities for the healthcare system to organize it so that better care can be achieved at a lower cost and less hospitalization. And all those examples here have shown that they achieve those results. It costs less money and it provides better care. In Sweden, they are at the cutting edge in terms of access to patient records. And as we said, in Denmark, sorry, got confused with another thing. So in Denmark, they have the same in Sweden, so that's why I got confused. So, and in China, I mean, this is one example, but the European Commission DG Information just released a book. It's a very heavy book, glossy paper, and it's hundreds and hundreds of applications for smartphones related to health. And here, this is one that was developed by Microsoft for Chinese diabetic patient, and it's basically designed as a game. And this is also an important trend that healthcare people need to take into account. Is the gamification of policy. Basically, you're using games to engage people in doing something you want them to do. So it's not just nudging people, but it's involving them in games. And if I have more time later, I can give you some good examples of those games. So this report came out with 5 key principles. And here, it's a mix of common sense, of system change management, like Six Sigma and all that, standardize the process. Once you standardize the process, then you can understand what type of skill you need where. And that's this idea of right skilling your workforce. More often than not, we see highly trained professionals managing the stock, the inventory of supplies. They're or doing administrative work. It's not the right or appropriate use of this resource. So those examples are basically redesigning the system so that you have the right use of your professionals at the right level. So I'm not going to go through the 5 key principles because I'm coming at the end of my talking time. But in the report, you can find a list of proposals and recommendations. The stars here are just indications from the people who wrote the report about quick wins, first steps that can be implemented. And again, in terms of technology, embracing technology. If you look at the quick win on aligning financial rules and incentives, which is the second box, one of the quick wins is pay for email, phone, web, group encounters. So that means that today the payment system for healthcare professionals is designed so that they have to meet the patient. So if policymakers don't change that, they're not going to see a lot of improvement in terms of innovative ways to interacting with the patient, because the healthcare professionals will not be compensated for that for doing that. It's very simple, but it's also very understandable. So this is the working group members, a wide array of different sectors, academia, ministers of health, different countries, developing, developed. And this is where you can find the report, A Neglected Resource, Transforming Healthcare Through Human Capital. And I put here the link to this innovative international partnership for innovative healthcare delivery, because they have additional examples. A lot of those examples can be replicated fairly easily. They are piloted and they are expanded. So I would invite you to take note of this report. Thank you.